Well, hello everyone. First of all, I would like to thank Professor Palumbo for the invitation. It is truly a pleasure for me to be here today. I'm going to talk about the applications of 3D ultrasound and volume imaging in fetal medicine. And by the end of this presentation, participants should be able to understand how useful is 3D and 4D ultrasound in prenatal medicine, the impact of three-dimensional ultrasound on the detection of fetal abnormalities, the clinical recommendations for the use of 3D and 4D ultrasound, and how to use different settings and displays. Well, I am an obstetrician and I work as a fetal medicine specialist, so I must confess that I'm not familiar with reproductive medicine itself. However, many of my patients have conceived through assisted reproductive techniques. And as you probably know, many of them have gone through long and difficult processes as unexpected diagnoses, surgeries, hormonal treatments, failed attempts, and sometimes also miscarriages. But after all of this, they finally get pregnant. This is happening and they come to me with all their history behind, and now all they expect is to see this. They ask for their scans in 3D, 4D, 5D, AI, and to be honest, I enjoy so much being part of good news. I love these scans as much as they do, but what I know, and sometimes they don't, is that sometimes this is also happening. They don't expect this. And sometimes during a 3D scan, we can also find an increased nuchal translucency. We can see a trap sequence in a monochorionic twin pregnancy. We can show a cleft lip. We can also see omphalocele, polydactyly, and even a twin pregnancy in a bicornuate uterus. So the key question is 3D ultrasound just useful to show beautiful baby's face, or it can also be a diagnostic tool in fetal medicine? Well, 3D ultrasound is available since 1980s. This is the first 3D image obtained in a pregnant patient that was performed by this professor of biomedical engineering in the University of Tokyo. However, it was only after the development of the most recent computer technologies and ultrasound systems that the 3D ultrasound reached the level of sensitivity and performance required to be seriously considered in clinical practice. It's true that 3D ultrasound helps to overcome some of the key limitations related to the imaging. It has been shown to be a problem-solving tool in selected circumstances. However, 3D ultrasound is not yet widely used on a routine basis in a perinatal medicine, and the role of 3D ultrasound is still being evaluated in many areas. Obtaining sonographic volumes rather than simple slices allows to demonstrate data in any plane and in any direction, and this ability has enormous potential for medical ultrasound diagnosis. Moreover, we can storage not only images but also volumes that can be reloaded and reanalyzed at any time, even without the patient in the room. The availability of several display modes allows the demonstration of both the normal and abnormal fetal anatomy from different angles. And when counseling the patients, the rendered images can help them understand the severity of an existing malformation, or on the contrary, we can ensure them of the absence of any fetal abnormality. We can show also the healthy babies. Depending on the suspected fetal malformation, we can choose the displayed mode that is best suited for the demonstration of the region of interest that we call ROI. So regarding technical aspects, every 3D and 4D ultrasound procedure basically consists on 4 essential steps: the volume acquisition, the volume display, the volume manipulation and processing, and the storage. I'm going to talk about those 4 steps. First of all, the volume acquisition And we have two different systems that are available. First of all, the freehand system. This one required a sensor to be attached to the 2D probe. The advantage of this technology is that it can be used with any commercially available probe. This one, the second one, the automatic, the one that is commonly known, has an automatic system that needs a special 3D, 4D probe that can only be used as part of the specific ultrasound system. It increases the cost of the machine, of course, but on the other hand, they offer two major advantages. The image quality is significantly better, and they can provide the operator for the ultrasound. And as part of automatic system, there is newer technology known as matrix probe that contains a large number of crystals and is electronically driven. It allows scanning in two planes simultaneously and permits actual real-time visualization with a very rapid sweep. When it comes to the volume display, already Belén explained how to use it in endometriosis, but we can also apply it for obstetrics. We have this multiplanar mode that in gray render modes, only the information in gray scale is showed. This multiplanar mode shows the three conventional scan planes by rotation and translation movements. Any arbitrary plane of the fetus can be visualized. In the median plane of the fetus, it is very important for us, especially in the first trimester, to show the correct demonstration and measurement of the nuchal translucency, nasal bone, or the face profile to rule out anomalies like prosbosis or retrognathia. We have also this 2E mode, the tomographic mode. It's also called the parallel plane mode that enables a detailed tomographic image of the fetus in sagittal, coronal, or transverse plane at different distances. So this region of interest can be displayed comparable to a CT or an MRI. Here, for example, we can see an abnormality in a baby's eyes. The surface mode provides the examiner with 3D images of fetal surfaces. A requirement for taking this volume is the presence of an adequate fluid pocket in front of the structure being imaged, and the absence of overlying structure such placenta, fetal limbs, or the umbilical cord. It shows not only outer surfaces, not only the skin of the baby, but also inner organs surfaces. Here we have an example of meningocele, gastroschisis, and bilateral cleft lip. The HD live silhouette mode that we can adjust to show external structures, or even with the high silhouette mode to see internal structures like a transparent mode, showing, for example, the developing brain in a baby in the early pregnancy. We have also the OmniView. It allows the visualization of a specific sectional plane by drawing a reference line, a polyline, or a curve, choosing a slice thickness of 1 to 20 millimeters. This one, it has great potential in prenatal diagnosis because it scans planes that are not accessible with conventional B-mode scanning. For example, here we are examining a baby with a cleft palate, and with the OmniView we can access to the inside of baby's mouth, which allow us to explore the severity of the palate defect. The transparent mode provides a view of the fetal skeleton and the normal or abnormal ossification. We can use two different rendering algorithms. The maximum mode that displays only the maximum gray levels of the row, so just the bones, and also we can choose the X-ray mode that presents all gray scale levels. We can also use this minimum and inversion mode. The minimum mode, only the gray scale is displayed. This mode can be applied for the demonstration of vessels, hollow structures, or cystic structures. So if we have a polycystic kidneys like here, the minimum mode will show us just the tissue of the kidneys. This will not show the hypoechoic areas. On the contrary, the inversion mode will convert the anechoic structures into hyperechoic structures, so we can see as solid structures hollow ones, so we can measure it like as if they were solid structures. We can also another volume display, that's glass body and pure color render mode. The glass body render mode combines color and grade values, so we can see the body of the baby and also the vessels inside. But if we want to isolate just the circulation of the baby, we can choose this pure color render mode that it shows only the color information of the Doppler signal. When it comes to the volume display of the 4D techniques, we have also the 4D surface mode. It is a fast acquisition up to 35 volumes per second. Both the surface and the movements of the fetus can be demonstrated continuously on the screen. This enables the operator and also the parents to observe movements of the baby, such as yawning, sucking, swallowing, mimicking, and body and lips movements. We have also the spatiotemporal image correlation. We call it cardiac stick mode. It provides the operator with a reconstructed cycle of the beating heart. There is a possibility of combining a stick and color Doppler, showing a detailed view of the cardiac blood flow. Here we can see the video is not playing, but we can see the valves and the heart of the baby in movement in every cardiac cycle. Even with the color Doppler, we can see the blood flows inside the baby's heart. Here, once a volume has been taken and stored, it can be manipulated in different ways. So we have obtained the volume and we can manipulate it after taking the volume. This planar reformatting we can use with the 4D view, and by rotation and translation movements, any scan plane can be reviewed in the multiplanar and the parallel plane mode after we have done the examination to the patient. We have also, regarding this volume manipulation, the electronic scalpel. This is a very useful tool because when using a surface rendering, the ROI, in this case baby's face, can be covered by adjacent or overlapping structures like the arm, the placenta, the umbilical cord, and these structures can be removed with the electronic scalpel to obtain high quality surface image. So here we have the baby with the arm in front of the face. We can just, using the magic cut tool of the scan machine, and we can delete it and removing the arm from the face. In some cases, the amniotic fluid shows low-level echoes that disturb surface rendering and should therefore be filtered out, but increasing the threshold value. Here is how we do the filtering. We can remove these echoes that the amniotic fluid is doing to have a high quality image of the baby. We can also do a 3D image post-processing. We can modify brightness, contrast, or even the color. We can put shadows, modify different tones of the color. We can also do measurements. If we take a 3D volume or image from the baby, not just the face, but in this case, the brain of the baby. We can take these images and take measurements on it. This is the measurement, the length of the corpus callosum in baby's brain. We can also do an image animation. It provides images at different angles, so the physician and the patient can see the object of interest rotating on the screen and obtain better spatial impression. So we can move the image from one side to the other to see different angles of the region of interest. Also, in the 4D cine sequence, a cine loop allows the examiner to display the cine sequence once again at different speeds and to scroll back through several volumes to choose a particular one. So if we have for the cine sequence, we can stop it, scroll back, increase the velocity, and stop at a picture that the parents want to see. For example, we are playing this video and at some point we will stop it and we will scroll back rapidly and show the pictures that we want to put on the screen. Then we go backwards and we can choose the image that we want to show. And finally, after the display modes, after manipulating the images, we can also store them. Once stored digitally on the hard disk of the ultrasound unit, the operator can retrieve the volumes at any time and navigate through this in the absence of the patient. These volumes can also be stored on an external hard disk, USB stick, on DVDs also for long-term storage. Well, now that you know the different display modes, I'm going to show you a few examples of the different fetal achievable anatomical structures. We can see the skull and cranial sutures of the baby. This allows us to check if the ossification of the cranial structures are according to the gestational age, even to diagnose a craniosynostosis. We can assess, of course, the face with this surface mode. We can show a normal developing face, but also abnormalities like a cleft lip. This helps the families to see how the baby will look like after the babies are born. That will help for them to create a spatio-temporal image of what's the malformation. We can also assess the central nervous system. We had explained this 2D display. We can use the ultrasound as a CT, and we can also see as a surface mode the different structures inside the brain, like the corpus callosum, at any plane of the brain. Also, we can check thorax and ribs. We have multiple displays to do that. We can do it with the surface mode, but we can also assess just the bones, and in this case, especially important on the right side, a case of congenital diaphragmatic hernia, where we can see the stomach inside the chest, close to the heart, and we could demonstrate that in a 3D ultrasound image. We can also examine the abdominal wall. Here, this is a case of gastroschisis in 2D, and then we can also see in 3D the bowel outside the abdomen of the baby. The urogenital system can be assessed as well, not only genital abnormalities, but also in the kidneys, as polycystic kidneys, unilateral renal agenesis, etc. Of course, the spine, we can assess the skeleton, but also with the surface mode, we can assess the overlying skin and diagnose or show to the families how is this spina bifida in a baby. Also the extremities, we can assess the surface, the skin, also the position of the limbs. We can show how a talipe looks like. We can demonstrate a polydactyly, and we can also assess abnormalities of the hands and feet. In this case, on the right side, there is a ectrodactyly in a 10-week pregnancy, and we can see how we see the abnormality in 2D, and we can reproduce that in the 3D scan. The heart as well. Let's see if I can show you. No, the videos of the heart are not working today, but we can see the heart not only in 3D static picture, but also moving and showing how the blood flows are going into and outside the heart. In one of those videos, we were showing a small VSD, ventricular septal defect, where we can show as the heart is moving, beating, how the blood is going from one ventricle to the other through this small VSD, ventricular septal defect. Here we can also assess the placenta. So this 3D ultrasound is not only useful for babies, but also the structures around the baby. This case is a bilobulate subcenturate placenta. We can see the placenta in 2D has two lobes, one anterior and another the posterior, and we show the cord insertion with this glass body mode. We can see the two lobes of the placenta, and in 3D how is the insertion, the cord insertion between these two lobes. So sometimes it's useful for us to have the proper three-dimensional image of the location of the placenta and the umbilical cord, especially in those cases of vasa previa, which is very important for the obstetric outcomes. Also, the umbilical cord, we can assess the insertion in the placenta, we can assess the presence of a vasa previa, we can assess the number of vessels in the cord, and also sometimes to pick up true knots in the umbilical cord of the baby. Also useful in multiple gestation, not only twins but also triplets, to see the location, to see whether the placentas are, and of course not only anomalies, but extent of anomalies. Let's say not a proper malformation, but markers that could be related to genetic disease, as the increased nuchal translucency. We know the accuracy of standard fetal weight estimation remains low, so in anatomical assessment it's been studied that the 3D ultrasound of the femur volume has been shown somehow a potential predictive value in fetal growth restriction. 3D ultrasound has also been applied to fetal weight estimation and evaluation of fetal nutritional status in attempt to improve the existing normograms for fetal weight and fetal biometry. In early pregnancy and first trimester, it's also important these 3D and 4D scans that has moved prenatal diagnosis of fetal anomalies from the second to the first trimester of pregnancy. Making the diagnosis of fetal anomaly in early pregnancy will have a great impact on patient care. So, a very important question here: is it time for a routine use of the 3D ultrasound in obstetrics and fetal medicine? So from 1980s, several attempts were made to develop 3D ultrasound systems. Many highly experienced operators were skeptical about the necessity for this new technology, and typical questions were, is 3D ultrasound more useful in prenatal diagnosis than 2D ultrasound? Does it improve diagnostic accuracy? Can we detect more malformations? Is it a useful routine analysis tool, or is it more time consuming? Nowadays, most ultrasound equipments have incorporated 3D and 4D technology into their scanning system. So most of us that are using ultrasound machines in our daily practice. We have a 3D and 4D technology included. So where these questions answer really? Well, 3D and 4D ultrasound expands the diagnostic possibilities in prenatal diagnosis and provide the operator with additional information compared with 2D ultrasound. It also offers a detailed demonstration of fetal defects, both other physicians and also the parents. The questions of the value of 3D and 4D in routine scanning or as a screening mode remains unanswered, unfortunately. It is important to know that nowadays 3D and 4D ultrasound does not replace 2D ultrasound. 2D remains the best way to examine the fetal anatomy, but 3D is a very useful addition. So regarding the recent research, we know already the advantages of the 3D and 4D ultrasound, but it's a tool that is still under research evaluation in certain areas, such as fetal behavior. There are multicentric studies of fetal brain function that have been carried out. The aim of these ones was to establish the standard of fetal body movements and facial expressions as additional diagnostic criteria for brain impairment. So showing how the baby is behaving through 4D scans and how the baby is mimicking and how it's behaving through the 4D scan should be important to additional information and criteria for brain impairment. The maternal-fetal bonding evidence suggests that, of course, 3D allows a better recognition of the fetus, which reduces anxiety, stimulates a prenatal bond with the fetus, and contributes to positive health behavior. Every family loves to see their baby's face, even if they are going for a standard growth scan. And this has been shown to increase the family bond to the baby. Diagnosis and follow-up of fetal vascular anomalies. We have shown that the possibility of deleting the grayscale images surrounding the color Doppler permit isolate the vascular tree, giving information about eventual malformations in the vascular system of the baby. The volumetric measurements of fetal organs. This is very important because apart from the study that we have mentioned before that predicted estimated fetal weight from fetal volume, there are others like this one from the Nicolaides team that reported the volume of the fetal head and trunk and documented that triploidy and trisomies 18 and 13 presented early onset severe asymmetrical growth restriction. In contrast, trisomy 21 and Turner syndrome, which are less lethal, present growth restriction in a milder and symmetrical way. For the ultrasound guidance for invasive obstetric procedures, it's also very, very important and promising that because it shows a needle tip in 2 or 3 planes, which permits an accurate needle placement, especially when the tissue target is small, as in CVS or chordocentesis. So, to conclude, the 3D and 4D ultrasound offers possibilities not available with 2D ultrasound. Making the diagnosis of fetal anomaly early in pregnancy will have a great impact on patient care. Also gives a friendlier professional environment. We know as well that acoustic exposure levels during 3D and 4D ultrasound examinations are comparable to the 2D B-mode ultrasound, and unfortunately is not yet widely used on a routine basis in perinatal medicine. It's just an additional tool, but cannot replace the 2D ultrasound. Thank you very much.